Hi, I'm Dr. Scott Luper. I'm medical director at White Spruce Medical here in Fairbanks, Alaska. And I'm here to talk today about COVID-19 and basically how to survive it. So here's the facts right now. Yesterday we got our first 2 cases of COVID-19. And what is going to be going on is it's going to go through our community. Now we're doing everything possible to keep the spread as low as possible, and folks are staying home as with elsewhere. The schools are closed, gatherings are canceled, restaurants are closing, all kinds of things are closing, and yet it's going to go through our community. There's no way to stop it. Nowhere in the world have they stopped it yet. But the key thing is we want to have it go through the community slowly so that our hospitals aren't overwhelmed with people, and most of you all know this already. I do want to go over how to survive it, but before I do, I want to talk about what actually goes wrong with COVID-19 and what's actually killing people. Now, the experience in China and Europe has taught us that about 20% of the people who get it are going to need to be hospitalized. 80% of folks won't. They'll get sick, some of them quite mildly, some of them won't even know they're getting sick, but 20% of us will need to go to the hospital. And the reason why is because our immune systems react so strongly to the virus. Now, the coronavirus group is a group of viruses that cause upper respiratory infections, things like colds and flu. And every once in a while, one of these comes along that's actually quite strong. COVID-19 is one of those. And in susceptible people, it will cause a severe reaction to the virus, such that it causes swelling of the lungs. Now, what's going on here is that there's a bunch of chemicals that our body releases to fight infections, and those chemicals are released in mass all at once, and it creates this inflammatory reaction. Now, since it's an upper respiratory infection, it affects our lungs, so what happens is our lungs swell. And when your lungs swell, they don't work so well. In fact, if they swell enough, they don't work at all. And what happens is the oxygen can't get through the membrane because the membrane's too thick, and the alveoli, the little air sacs where all this happens, will fill up with fluid, and then no oxygen will go through. So it turns out that the key thing that keeps people alive is a respirator. What happens when oxygen levels, when your lungs don't work, your blood oxygen levels drop, there's less oxygen being brought to your organs will start to fail, and that's what's actually killing people, is organ failure, triggered by the low oxygen. So the respirator is key. It is the most powerful tool that doctors have in their tool chest to keep people alive with this infection. And the problem here is if we all get sick at the same time, there's not enough respirators in town to treat us all. So that's why we need to flatten the curve. That's why we need to stay home. That's why we need to minimize our contact to keep our social distancing, so the spread of this is slow. Now, this is going to be good because it's going to help people survive so the hospitals won't be overwhelmed. There's a downside to it, though, which is the condition, the infection, the epidemic is going to linger, because it's not like we're all going to get it at the same time. Some live, some die, and we're all done with it, in a month. That's not going to happen. Thank goodness for that, too. What's going to happen is we're going to get it at a trickle, and it's going to linger in our community. So that we're going to be in this for the long run. This is not going to go slow. And the degree to which we're successful with our efforts to slow the spread, stop the spread theoretically, but slow realistically, is the degree to which it's going to linger in our community. Now, eventually there'll be a vaccination, and this will all be in the past, and most of us are going to survive this just fine. But my point today is to try to help all of us survive it the most we can. Now, here's the problem with this. We know how the disease progresses because it's been tracked and we've seen it before. What we don't know is what we can do to shut down this inflammatory reaction. Now, doctors know that if they give patients steroids, that they can slow down the immune reaction or stop it. And so they tried that. And what happens is once you shut the immune system down, the virus replicates without any breaks. It runs rampant, and people are actually dying of the virus. So steroids don't work. Your doctor won't use them. We all know this. But just letting the immune system run rampant doesn't work either, so there must be some way we can dampen this down. And it turns out we do know ways to calm the immune system slightly. And we know this from other viruses. We know this from influenza and other strong viruses that we've treated, and this comes out of the research. So it turns out there are some things that you can do. Now we don't know for sure whether any of these things will work with COVID-19 because the research hasn't been done yet. It just doesn't exist. But based on research from other viral infections, here's a short, likely list to help keep you alive, particularly suitable for people here in Fairbanks, Alaska, in the far north. Number one is vitamin D. Vitamin D is a decent antiviral. It's an excellent anti-inflammatory. And it's decreased the rate of getting influenza about 75% in populations in northern climates like Finland and other places. So that's a remarkable drop in influenza. Now, this is not influenza we're talking about, but it's an upper respiratory infection. It has this very strong immune reaction. So my guess is we can moderate the immune reaction by having people take vitamin D. The next thing on the list is fish oil. Fish oil is also an anti-inflammatory. And by the way, vitamin D is mild. It's not going to get in the way of anything that the doctors are going to do. It's just going to help. It's not going to hurt. So it's one of the reasons why it made the list here. We can think of 50 things to put on this list, but I don't want to tell you about 50 things. I want to tell you about a short list of 3 or 4. Vitamin D goes top of the list. Fish oil is also helpful. It's an anti-inflammatory. It's not that strong of an anti-inflammatory. We don't want to shut inflammation down. We just want to dial it down a little bit. Likewise with vitamin D. But one of the nice things about fish oil is it improves circulation. It thins the blood slightly. And it turns out that the people who are most susceptible to dying from this immune cascade are folks with poor circulation. Now, you'd think that people with lung disease would be the ones at greatest risk, but they're not. Now, the risk is higher, but poor circulation is top. And second to that is diabetes. And one of the key characteristics of diabetes is poor circulation. Their immune systems don't work so well either, so they're kind of a double threat. But improving circulation can help keep you alive. Improving circulation can help your lungs deliver oxygen to your organs where they're needed. Remember, it's not lung failure that's killing people, it's organ failure, secondary to lung failure. So if we can keep the organs healthy with more oxygen coming in, dial down the inflammation, you can help. So logically, fish oil should help. By the way, dosages, let me go back and talk about the vitamin D. The vitamin D dosage I'd recommend right now is 10,000 IUs a day. That's the upper limit, short of toxicity in some people. If you take too much vitamin D for too long, your calcium levels will go too high and you can get cramps. It's not deadly, but it's not great either. So 10,000 IUs a day is what I recommend. Fish oil, a couple of teaspoons a day, maybe a tablespoon, depending if you're a little bit larger. The next thing on the list is zinc. Again, it's a mild antiviral. It doesn't have any anti-inflammatory effects, but zinc is a safe thing to do. We've been using it for a long time to mitigate the effects of the influenza. And then the last thing on the list is mushrooms. And mushrooms are interesting because they don't shut the immune system down. They can actually enhance immune function, but they dial it down at the top. If it's low, they bring it up. If it's too high, they bring it down. And when I talk about mushrooms, I'm really talking about mushrooms, like pretty much all mushrooms. Now, some are better than others. Reishi mushrooms, particularly good for this. The scientific name for that is Ganoderma. Chaga, here in Fairbanks, it's a mushroom that grows on the birch trees, is also particularly effective, which is nice. We live in Fairbanks. We could actually go in the forest and cut it off trees. Anyways, chaga is another thing I recommend, and what I recommend doing with chaga is doing it as a tea, drinking 3 cups of chaga tea a day. Reishi mushroom, I suggest taking it in capsule form, or you can do it in a tincture as well. There's a number of ways to get it. You can eat them whole for that matter. And I recommend doing a couple of caps twice a day. The caps have 350 milligrams in them typically. But it turns out that pretty much any mushrooms are going to work. The mushrooms you get at the grocery store have a mild effect, but they're somewhat helpful. And then the last thing, that's enough, it's a list of 4 things to take. The last thing is common sense, which is you need to get plenty of sleep, you need to eat well, you need to get, vitamins and minerals in from eating vegetables, all those things that you know already to keep yourself healthy, to keep yourself, your immune system on its toes so it can fight appropriately and not overreact. Those are the things that you need to do. And then one last thing is fever. So often when people get sick, they think what I need to do, and they get a fever, what they think what I need to do is shut this fever down. So they take aspirin or Tylenol or Advil or something like that to knock the fever down. Don't do that. Let the fever run. It turns out the fever is helping you. It's your immune system doing what it can to get over the virus. Now, if you get really sick, you need to go to the hospital because you're going to need to get, chances are, you're going to need to be put on a respirator. Remember, we know this from experience, 20% of us are going to get sick enough to have to go to the hospital. So don't think that all these other things are going to save you necessarily completely, because some of us are going to get this anyways. What I'm trying to do is trying to tip the balance to lower the percentage of people that die, to tip the balance to increase the number of people that survive this thing by doing some things that we know from past experience that's helpful. But again, common sense is the key thing here. Let the fever run, because the fever is going to be helping you. The fever is going to help get over this illness. Let your immune system do what it's going to do, and do everything you can if you get sick or when you get sick. And then do everything you can in the meantime to stay as healthy as possible. This is not a death sentence by any means. You have every chance of surviving this. Engage. Use your wits, and best of luck to you.